Your doctor just told you that you have fatty liver disease. Maybe it was discovered during a routine blood test, or maybe you've been feeling tired and bloated for months. Either way, you're probably wondering, is this reversible? Or am I stuck with this forever? Well, your doctor might not have told you this, but fatty liver disease is completely reversible when caught early. In fact, recent studies show that 40 to 60% of patients achieve complete reversal within just months, using specific lifestyle changes. Hello, Vitality Champions! Today, I'm going to break down exactly how to do that. 5 simple science-backed daily habits that can help you take back control of your health, starting today. So if you're ready to feel better, live lighter, and support your liver naturally, make sure to subscribe and stick around until the end, because habit number 5 is the one most people skip. But it can make all the difference. Before we get to that, you need to understand what's really happening in your body right now. If you're watching this video, chances are you're between 40 and 65, and you might be dealing with some combination of these. Unexplained fatigue, stubborn weight around your midsection, brain fog, or those mysterious aches and pains that seem to appear out of nowhere. See, your liver isn't just processing toxins. It's your metabolic command center. When it's clogged with fat, everything else starts breaking down. Your energy, your mood, your ability to lose weight, even your sleep quality. I understand what it's like to feel like your body is betraying you at that age. That sense of losing control, of feeling like nothing works the way it used to. But the good news? The liver has remarkable healing powers. Unlike many organs, it can actually regenerate, building fresh, healthy tissue to replace what's been damaged, as long as you give it the right conditions. And those conditions? We're about to create them, starting with habit number 1. Habit 1. The Mediterranean Protocol. This first habit might surprise you, because it's not about restriction. It's about strategic addition. Sounds better already, right? Believe it or not, one of the top liver dietitians at UChicago Medicine tells her patients to drink 3 cups of coffee a day, drizzle on 4 tablespoons of olive oil, and stick to a Mediterranean-style diet. Wait, what? 4 tablespoons of olive oil? 3 cups of coffee? This sounds like the opposite of what most diets tell you. Here's why it works. Olive oil's monounsaturated fats enhance fatty acid oxidation while suppressing harmful fat production in your liver. Essentially, they help your liver burn existing fat while preventing new fat storage. Coffee, on the other hand, those 3 cups a day provide powerful compounds that reduce liver fat and inflammation. The polyphenols in coffee actually support the growth of brand new cellular powerhouses inside your liver. But not so fast. There's something else you need to keep in mind. It's not just about adding a few tablespoons of olive oil to your current diet. The Mediterranean approach shifts your entire macronutrient balance. About 40% of your calories come from healthy fats, compared to just 30% in a typical diet. And the rest comes mainly from vegetables, fruits, fish, whole grains. Your daily targets should be 2 servings of vegetables at both lunch and dinner, fatty fish twice weekly, nuts and seeds daily, and red meat limited to special occasions only. I know that's hard to hear if you're used to having meat at every meal, but the research is clear. The Mediterranean diet is the best option. Habit 2. Weight loss. The right way. Now. Don't be afraid. Yes, we're talking about weight loss, but not the way you've been taught. Most women think they need to lose weight fast to reverse fatty liver. That's not just wrong, it's dangerous. Rapid weight loss actually worsens fatty liver disease. Research shows 5% weight loss reduces liver fat, 7% reverses inflammation, 10% can reverse liver scarring, but the method matters more than the number on the scale. When you lose more than 2 pounds weekly, your liver thinks you're starving, so it starts holding onto fat as a survival tactic. On the other side, a recent 2025 study found that when people lost about 5% of their body weight, gradually, around 40% saw lasting improvements in liver health. For a 160-pound woman, this means reaching around 150 pounds over 3 to 4 months, not 3 to 4 weeks. Sounds doable, right? After a certain age, your metabolic flexibility, your ability to switch between burning fats and carbohydrates, starts to slow down. So, you've got to be smarter and more strategic about how you fuel yourself. The most effective pattern? Intermittent fasting windows. Combined with Mediterranean principles, eating within an 8 to 10-hour window, starting with protein and healthy fats. Ending with a light dinner, at least 3 hours before bedtime. Habit 3. Exercise as medicine. Exercise reduces liver fat, even without weight loss. Focus on Zone 2 training. Exercise at 60 to 70% of your max heart rate. This is where you can still hold a conversation or breathe through your nose. This allows your body to burn fat for fuel without triggering excessive cortisol. Then add resistance training 3 times a week. Yes, some weightlifting. It works just as well as cardio for reducing liver fat. And it's crucial for women over 40 because we naturally lose muscle as hormones shift. If you're short on time, HIIT is an option. Studies show that just 20 minutes of HIIT, 3 times a week for 12 weeks, can significantly reduce liver fat. A good weekly routine might look like 2 days of 30-minute moderate walks, 2 days of 20-minute HIIT, 3 days of resistance training. And no, you don't have to exercise 7 days a week. Your hormones need rest days. Habit 4. Say goodbye to alcohol. For now. Here's the hard truth. There is no safe amount of alcohol when reversing fatty liver. Even occasional social drinking, more than once a month, slows progress dramatically. Non-alcoholic fatty liver requires 3 to 6 months of alcohol-free living for optimal reversal. As estrogen drops, your liver's ability to handle toxins weakens, so alcohol becomes a double hit to your detox system. If you're used to drinking regularly, slowly taper over 2 to 3 weeks to avoid withdrawal symptoms. Your reward? Your liver starts producing new, healthy cells, just days after you stop drinking. Every day without alcohol is a win. Habit 5. Manage blood sugar, the root issue. Insulin resistance drives fatty liver disease, and fatty liver makes insulin resistance worse. It's a vicious cycle. This isn't just a weight issue. Hormonal changes, especially post-menopause, can cause insulin resistance even at a healthy weight. Your body handles insulin best in the morning and worst at night. So you want to eat bigger meals earlier? Keep dinner light. Finish eating at least 3 hours before bed. Here's a simple plan. Protein-rich breakfast within 2 hours of waking. A balanced lunch with healthy fats and complex carbs. A light afternoon snack if needed. And a small dinner, early. If you want to level up, continuous glucose monitors are now available without a prescription. They show exactly how your blood sugar responds to different foods, especially helpful during hormonal shifts. Bonus habit: manage stress. Chronic stress keeps cortisol high, and high cortisol worsens insulin resistance. So, morning mindfulness, no screens late at night, 7 to 9 hours of sleep. These aren't luxuries. They're essentials for reversing fatty liver and restoring your health. Thanks so much for watching. If you found these habits helpful, drop a comment below. And don't forget to like this video and subscribe for more tips to help you feel restored and healthy at every stage of life. It's never too late to take back your vitality. One simple habit at a time. See you in the next video.